I am Dr. satyanarayana Murthy, consultant spine surgeon, Kim Sunshine, Secunderabad. Now I would like to talk about back pain in elderly people. With the increasing lifestyle and also increasing lifespan, like elderly age group, like more than 65 years of age, people coming to our clinics with the concerns of back pain. Usually the problems with the elderly age would be degenerative changes, like after 55 or 60, your spine starts degenerating, causing compression on your spinal cord. It can be either in the neck, that is cervical spine, or in the lumbar spine, that is lower back, which is most commonly seen. The usual symptoms in the elderly would be back pain and also walking difficulty. Walking difficulty is like pain going into both the limbs, what we call it as sciatica in the common words, and also your ability to walk for a distance is coming down. Like if you are for 100 meters you need to walk, you will have to take a rest because your limbs are becoming heavy and you will have to take a rest. This is what we call it as claudication. And the reasons for this claudication, what is the neurogenic claudication, is severe spinal canal stenosis, which is most commonly seen in the lower lumbar spine, which will require medical management. Many a times in this age group, like lumbar canal stenosis, you require surgical intervention. Surgical intervention can be a simple decompression or any other treatments like fusion surgery. Fusion surgeries is where we completely decompress the spine, but sometimes with this decompression your spine may become unstable. So to avoid this instability in the spine, we do fusion surgery, so like placing screws in your lumbar spine and reconstructing it with the rod. So with this procedure, people quality of life is increasing. Like earlier, where you are not able to walk for some distance, your walking distance is going to improve. With that, your other problems also, like you may not land into this other complications of being sedentary, like obesity, having cardiac issues or pulmonary issues. The other problem with the elderly age, like if you are above 70 or 75, is osteoporosis. Osteoporosis is mostly seen in females above 60, and males it can be above 70, or sometimes you don't see in osteoporosis in male patients. The problem with osteoporosis is there can be a fracture in the spine with or without injury. A trivial fall or just getting up from the chair and a sudden twist can cause compression fractures in the lumbar spine or the dorsal spine. The treatment would be, many times it is medical management, like giving braces for your spine while to walk, or increase the quality of bone. Increasing the quality of bone, there are many medical therapeutic agents like injections or daily injections, or injections which are taken on a 6-monthly basis. Sometimes this pain may not get better even with the injections, and there would be severe discomfort coming out of the bed or changing of the position. So in those cases, we will have to evaluate thoroughly, and they may require some procedures like cementing of the bone, which are very, very minimally invasive, which are done on an outpatient basis, like what we call them as percutaneous cementing, like vertebroplasty or balloon kyphoplasty. These are basically pain procedures to increase your quality of life by decreasing your pain. And but not always osteoporotic fractures require surgery, but it has to be treated. Even if you are getting it operated, the medical management to continue this osteoporosis is very, very important. So to conclude, with the quality of life, I mean, with the aging population, with the increasing aging, to increase the quality, because our quality of life has changed. Because earlier, after 60 or 65, in our Indian scenario, people used to be most of them at rest. But now we see them being very active. So to increase the quality of life, there are multiple procedures in spine surgery or multiple modalities of treatment. So if you have any back pain in the elderly age group, don't hesitate to see any doctor, and don't think that bed rest is a solution for everything. Thank you.